Coming up, we'll be on location at Endres Dental Care in Burtonsville, Maryland, discussing the latest advances in dentistry and how they can improve your oral and dental health with two of this area's top dentists, Dr. Eric Endres and Dr. Aaron Nichols. Welcome, Dr. Endres. Welcome, Dr. Nichols, to the Top Doctors Interviews program.
Thank you for having us.
Yes, thanks for having us.
All right, it's a pleasure. There's been so many advances in dentistry over the years, and there's so many different treatment options. And I wanted to begin by asking you if you could please tell us what some of the most common dental problems you see in the patients that come to your practice.
Well, so nowadays, for adults, still one of the biggest problems that we see day in and day out is just simple tooth loss. Most people in America have actually lost at least one tooth. There's about 120 million people missing at least one tooth, and you'd be surprised to find there's even 36 million throughout the United States who have not a single tooth. They're missing all of their teeth. So it's something we see day in and day out. Now for kids, the biggest thing we see, aside from cavities, which is always going to be a problem, is malocclusion, or their bite being off, crowding, spacing, things like that. And I'll let our orthodontists talk about those problems, but for adults, it's mostly tooth loss.
And what type of treatment options are available for patients that are missing teeth?
For patients that are missing either one tooth, two teeth, or sometimes all their teeth, probably the newest technology that has become simpler and simpler and more streamlined has to do with dental implants. So you lose one tooth, we can just put an implant in and put a crown on that, and you're back to a full bite, everything's restored. If you're someone who unfortunately has lost all their teeth and maybe you have a denture and it's not really sitting well or something of that sort, we can actually place implants that will allow that denture to sit more comfortably, or we can actually replace all those teeth with a series of implants and then crowns and bridges placed on top of those. And so that's probably the newest and most comfortable thing that we can offer these days.
So are dental implants a treatment option that anyone can have done, or are there certain restrictions where certain people just can't have it done?
The only true restriction so far is that you want to wait until somebody is fully grown, or at least really close to. So we tend to not do them on children if they're missing teeth. We tend to wait until they're at least 18 years old. But for most adults, there's not really anything that makes it totally impossible. The only situations that make it more complex is based on how much bone you have available. So the longer you've been missing your teeth, your bones of your jaws actually tend to resorb. So in those cases, we tend to need to do bone grafting and grow bone back, because healthy bone and gums is the most important part of dental implants working for a long time. But the short answer is that there's nobody really that it's impossible for.
And what's the patient process if someone's missing teeth and they're looking to get dental implants and they contact your practice? What's the process they can expect?
It's very similar to getting any other sort of dental work done. You know, you come in, we do an examination of your mouth, we take x-rays and see how much bone there is, find out what you need, what you want. We also need to look at the medical history, because this is a process of healing and that sort of thing. And for the most part, that gets us on the road to get started, and then we can start as soon as they have time, and we can kind of get them in.
And then once we decide to move forward and your goals align with ours, the implant process is pretty simple. It takes a few months generally, because we want to make sure everything heals well. But usually the first step is putting in the implant body itself, which acts like the root of a tooth. So that's what sits inside the bone, and we need the bone to just heal solid around that for a few months before continuing. Then the next step, once it's healed, is we put what's called a crown on top. The crown is just a tooth replacement. Looks and feels and chews just like a tooth. That gets screwed down permanently on top of the implant that sits inside the bone, and it looks, acts, and feels just like a tooth. So generally a few months process, not much longer than that unless something is more complex.
And what would you say are the key patient benefits from getting a dental implant or dental implants as compared to other options?
Especially with front teeth, the biggest advantage is aesthetics. If you're missing a front tooth, there are other options historically that will work, but none of them fully as aesthetic as a dental implant, because it's the true single tooth replacement. Now, even some people with bigger smiles, you can see spaces all the way in the back. So even if you're missing a back tooth, this can help with the aesthetics as well. And then the more obvious, but the one advantage that most people don't think of, is just true function and being able to chew. You don't realize it until you're missing a few teeth in the back, how hard it is to chew when you're missing something. So adding dental implants back in is really the most sturdy replacement compared to dentures or other removable options that no matter how well you make them are always going to move a little bit. So an implant is the closest thing you can get to chewing like normal again and enjoying eating.
Well, those are really major benefits that really affect our life, improve our life, not only aesthetically to give us that beautiful smile, but also to let us eat steaks and things that we really enjoy in life. Now, we all know that dental implants have been around for some time, but there's been some significant advances over the years with the technology. Can you tell us a little bit about what it is and how that's helped patients?
Sure. So in the past, what we had were basically 2D X-rays. That's the X-rays we all sort of grew up with. They were on film. Now they're digital, which is a significant advancement in technology. But now we actually have a 3D X-ray, so that we can actually take an X-ray that shows us in all dimensions what the teeth and the bone look like, what we can expect when we go to place an implant, and it's actually made it much simpler to place implants and made it much more available to all patients, because before we might look at a 2D X-ray and go, we're not really sure. Now we can look at a 3D X-ray and we can be really sure about what we're going to find when we start that process. And so it makes everything just go much, much smoother.
So what type of results are your patients seeing from the dental implant placement?
Well, similar to what we were talking about with just the advantages, they're seeing more aesthetic results because this doesn't require a lot of plastic in your mouth like a denture might. Also, much more enjoyable results when it comes to just everyday life because you're not worried about a dental implant falling out like you would be a denture. You're not worried about it moving around while you're trying to eat a steak or whatever your favorite food is. Just much more natural results, and really the goal with most dentistry is for you to not notice it throughout the day. A dental implant takes a lot of that worry away, where if it's working right, you don't even know it's there, and you're able to smile, laugh, enjoy eating, all the things you want to do without really having to worry about your teeth and your smile.
And how long do dental implants typically last?
Dental implants, they aren't your natural tooth, but they should last a good long time. And the biggest issue with making a dental implant last is maintenance. So making sure that you're cleaning around it properly, that you're getting it checked periodically at the dentist, and just to be sure that you're not having any issues. And then if there are issues, we can catch them really early, take care of them, and you're kind of good to go. So they should really last a really good long time.
So it's really like getting your natural teeth back, because those are the same steps that you'd have to do to take care of your natural teeth as well.
Exactly. So it's as close as you're going to get to your natural teeth, and kind of like you said, the steps of taking care of it is very much the same as taking care of your own teeth.
Your practice offers so many advances in technology. You really focus on the patient experience, and that includes comfort for the patients and minimal discomfort from treatments as well. Can you tell us about your approach and how you're able to do that?
Of course. I mean, one of the biggest reasons why people avoid dental treatment is discomfort and fear. And a lot of that comes from either childhood bad experiences or just the bad reputations dentistry has had from the olden days. One of the biggest advances in dentistry that nobody really talks about is just how good the local anesthetic has gotten. So it used to be Novocaine, but that's gone by the wayside, and everything that we have now works incredibly well. We do a lot of steps, both of us, to make sure that even the shots themselves, you don't feel them. So from that whole process, it's much, much more comfortable nowadays, and the fear of pain really shouldn't be a fear that drives you away at all. On top of that, we use oral scanners nowadays. We take intraoral pictures that blow up your tooth on the big screen so we can show you and explain what's really going on. The scanners themselves provide a really accurate way to capture and make models of somebody's teeth so that we can make really well-fitting and aesthetic crowns, veneers, and orthodontics. We use it a lot as well. And we really focus most on the comfort of patients, because surgical things, especially like implants, people are worried that it's going to be a lot of soreness and discomfort and the procedure is scary. But even something like a dental implant, most times nowadays you only just take a little ibuprofen when you go home.
That's very impressive, because we all remember the old days when people were, just connecting pain with going to the dentist, like you said. When we were young, we may have had a bad experience, and then that creates that fear and anxiety. And so many people in society suffer from dental anxiety or going to the dentist. I think it's like the second or third most feared treatment or place to go. So what you've done here and what's happened with the advances in technology is really taken it to the next level, taken the experience to the next level, made it much more pleasant. As far as the sedation dentistry goes, Dr. Nichols, how is that performed, and what is the patient experience like?
Yeah, so sedation isn't all one thing. You know, you say sedation dentistry, and it's not one particular procedure that we're doing. But sedation dentistry is really about what level of assistance do you need to be more comfortable coming to the office. So we have folks that just come in for traditional nitrous oxide or laughing gas, which is just, it's very mild. It just kind of lightens things up a little bit, makes the patient more comfortable going through things that are not necessarily painful, but just kind of annoying to have somebody working in your mouth. And it just makes that better for them, and that works fine. Then there are patients that may have had a bad experience in the past, and that really colors how they see doing the dentistry. They know it's important, they know it's valuable, they want to come in and get things done, but they just need a little help to be able to come in for procedures and to walk in the door. So in those cases, we can give them some pills that they might take at home, usually the night before to help them sleep, and then the day of, and then that way they can come in, they're much more relaxed. Many times once they're numbed up, they kind of fall asleep in the chair. Just because they're finally comfortable, they're finally relaxed, and then we can go through the procedure, and that way they can get a number of things done at one time without having to feel like they're constantly uptight and worried about if it's going to hurt and that sort of thing. Like Dr. Endres was saying before, local anesthetics, there's been a lot of advances there, and I've been practicing for 30 years, and there were days we couldn't get people numb. These days, I can't remember the last time we had a patient we couldn't get numb.
That's very impressive. I mean, it's really taking dentistry to the next level. And you, at your practice here at Endres Dental Care in Burtonsville, Maryland, have provided excellent dental care to so many patients over the years. You've established a reputation for excellence in dentistry and patient care. Can you tell us a little bit about what your vision is for the practice and what you feel separates you from other practices in the area?
We have a really interesting story. Dr. Nichols started the practice in this exact location 33 years ago?
34 now, 1988.
34 years ago. And through that 3 decades of practice, developed an incredible reputation for not only just being a really good person, but for keeping patients comfortable and providing a really high quality of dental care. I started working with Dr. Nichols a few years back, and at that time I was working for him. We developed a really strong working relationship, and it's really hard. If you've been around dentists enough, you know they have many different opinions and philosophies, so it's very difficult to find 2 dentists who agree on how to treat people, not only from the dentistry aspect, but just from a personal standpoint as well. So I feel incredibly lucky that we ended up just by chance together. I then purchased the practice from Dr. Nichols, and he continued to work with me as well. And moving forward, I really just want to continue the same tradition that we've had for 3 decades in Burtonsville. Tradition of patient comfort, looking after the patient first, and really just being a friendly environment for people where they want to come to the dentist.
Well, that was very informative, Dr. Endres, Dr. Nichols. It was great having you on today, and you've really helped us understand about some of these advances that really can help patients get better outcomes, better results, and a much better dental experience. And I want to thank you so much for being a guest today on the program.
Thank you so much.
Yeah, thanks for having us.